To support patients to manage their long-term conditions, we've got to make sure they're motivated. They've got to want to, otherwise nothing will happen. But how can we establish and build motivation in limited time?
We're going to see a health professional. Perhaps we've got a long-term condition review, or we're suffering with a symptom. We've probably got lots of other things to worry about too. It can be confusing and even scary.
As a health professional, we also have a lot to think about. We're busy, we've seen the condition a lot, and we know the risks if people don't take action. From our perspective, our patients should care about their condition, and it's easy to assume that they do. In a busy surgery, having discussed their condition for a while, we might be tempted to quickly outline all the things they could do. However, this doesn't always work.
We've a lot going on in our lives. It's very easy to carry on as before.
Before we discuss options like exercise, a referral, or even medication, we need to make sure the patient is motivated. To do so, we can find out their values. We can ask, what's important to you about this? About your condition, your medication, your health? With enough trust and rapport, the patient may be open to exploring their health concerns and what they want.
However, a patient may initially look confused. Not everyone's been asked about their values before.
So, having reminded them of the topic, their condition, their medication, you may need to ask again, I'm curious, what's important to you about this? And hopefully they'll share with you their values. Specific values can be more powerful. Hence, in response to a vague concern such as my health, we might ask, what do you mean by your health? To find out the patient's concern, they might have a stroke like their father did.
Sometimes a patient may say they don't know, or there's nothing important to me about my condition.
You can then ask, what's important to you more generally in life? And with enough rapport, they'll have an answer.
You're likely to hear things like family or being independent.
Having elicited their values in life, you can ask about any connections they see between these values and their health. Gently question to support the patient to make connections, and you can offer your own if they get stuck.
For example, the patient might realise that their ability to breathe well and walk greater distances would enable them to keep playing with their grandkids in the park.
The next step might be building a specific goal. Together, you can clarify something they'd like to work towards.
And following the conversation, the patient is much more likely to retain their agreed plan because it's connected with their values, because it's important to them.
To support change, patients need to be motivated. Before discussing actions, we can elicit their values by asking, what's important to you about this, or about life in general, and then support them to make connections between these values and their health.